Hi, I'm Luke, and yesterday I had my post-op consultation with Mr Antony Fitton down in Plymouth. The appointment went so much better than I was expecting. It was absolutely incredible. To be able to see my results for the first time was unreal. It was the best feeling ever. So excited. The appointment went really quick and there was nothing stressful about it at all. It was really quite emotional, actually. I was unbelievably happy with my chest. Mr Fitton seemed impressed with the results, and so did the nurse. They both seemed like they were happy with how I was healing. So yes, for the whole appointment I had Mr Fitton and a nurse present to do all the dressings and all that side of things, where Mr Fitton was able to check that everything was okay and make notes. When I got into the appointment, I just got undressed and laid down on the bed, and so yeah, it went straight into it. And then Mr Fitton was standing watching as the nurse took off all the dressings I had on, and he was just like keeping an eye and making sure everything looked as it should do, basically. And he was very happy with how the swelling was and the bruising, and yeah, how my nipples were looking. Especially once Mr Fitton could see that everything had started to heal really well, the nurse then carried on to take the steri strips actually off of my scars. I didn't have my little dressing things sewn onto my nipples at all. They were just like a little cushion that was stuck down by the plaster, the dressing. I mean, so yeah, the only remotely painful bit was having the steri strips taken off. It was just like a little bit stuck on some of them, but really I didn't feel anything. It didn't hurt at all, nothing like that. And it was really quick to get all the dressings off. Once the steri strips were off, the nurse started to wash my incisions and my nipples, and it made it look so much better once she had wiped it down and gotten all the stuff off of it that had dried, all the blood and things. It looked absolutely incredible once she had cleaned it, really. It also just felt really nice to have everything clean, because I haven't been able to wash that part of my chest for the 2 weeks, so having some form of wash was really nice. Whilst the nurse was taking off all the dressings and things, I had Mr Fitton walking me through what to do for my post-op care, just covering things like how long I keep my nipples covered for, and how long I put the scar tape on, and when I can shower. It was all really easy and nothing technical. I was quite surprised at how quick I could shower, so I now am allowed to shower once a day, and the more the better, basically. Mr Fitton has a saying, I think it's the solution to pollution is, no, what did he say? The solution to pollution is dilution, I think, is what he said. And the nurse said to me later on that basically what he means by that is the more you shower, the better, because it can bring down the risk of infection. So the more you keep that area clean, the better. He noticed a bit of swelling on both sides of my chest, and when he pressed it, you could see it moving, which is really weird, because I hadn't been able to see that part of my chest because it was under the dressings, so that was quite weird. But he wasn't concerned about the swelling whatsoever. He didn't feel the need to drain it, and just said that it would eventually disappear. It would just go on its own. And he then just took a photo of my chest for his records, and the nurse then covered all my chest area back up again. And basically what that was is I have two little dressing on my nipples, and she also put some scar tape over my incisions. I carried on laying on the bed talking to the nurse about a couple of things that I wasn't sure on, while she was just finishing up putting everything on my chest, and my mum was sat over with Mr Fitton talking to him, and I then just got dressed again, and that was kind of it. That was the end of my appointment. I think I was only in there for about 15 minutes. It was very quick, to be honest. Yeah, I was quite surprised. I was expecting it to be a bit more in-depth than that, but then I'm amazed at how quick the dressings came off. That's what I was expecting, to have more time, because I didn't realise you just pulled them off and that was it. So I was really shocked and impressed that it took minutes to take it all off, really. And that's what shocked me, because I thought it would be they were sewn on and you had to cut them off, and yeah, it was nothing like that. So for my post-op routine, I have to continue wearing my binder as much as I possibly can for the next week or two, just to help the swelling go down and to support my scars and things as well. Once we got home last night and I had a shower straight away, I then put my binder in the wash, and I haven't been able to wear it since because I'm waiting for it to dry. And I feel a lot better in my binder. I feel a lot safer. My chest is supported, if that makes sense. So as much as I hate it, I do prefer wearing it at the moment. Just everything feels a bit more safe and in place. I'm going to continue wearing it day and night for the next 2 weeks and just taking it off to clean it. Or if I get really, really bad, it's not the worst thing in the world right now, although my armpits really hurt. It's really sore against my armpits. I have to put it up as high as physically possible because otherwise it sits on my nipple and then it hurts my nipple. One thing that I always heard was different for different people and their surgeons was about how much movement you can do after your surgery. So I double checked with the nurse what I could start to do because I didn't want to do anything too much, but I didn't want to cause damage to my scars. So she told me that I can start to do like light movements, nothing like bodybuilding or anything heavy like that. But she said that the more I move now, the better, because once my scars start to like heal and set, if I'm not moving more at that point, then it's going to be more difficult later on. And then I run the risk of like my scars possibly opening because I move too much and they're not used to it. So that would then increase like infection risk and possibility of them not healing properly. So she said to start lifting up for things and bending down and picking up things and moving. So I mean, I'm not going to overdo it, but yeah, light movement is what she recommended because it's better to start that now rather than weeks or months down the line. So I can start to move, which is good because I felt able to, so knowing that I can do that makes me a lot happier because then I'm listening to my body, which makes sense to me. For the next week or two, I have to cover my nipples. So I have these like little, if I show you, I have these little dressing squares over my nipples on both sides, obviously. And I just have to take them off when I shower, have a shower, wait for my chest to dry, and then put them back on. And I have to do that for 1 to 2 weeks, and then I am safe to just have my nipples out all the time. And as I said earlier, it's really important for me to have a shower once a day. I shower with my scar tape on. If it falls off at any point, I just have to re-put it on, and making sure it's like tight across my scars, and the fact that making sure it is stuck constantly as well, because otherwise it doesn't do its job, and what's the point in that? I have to use my scar tape for the next 3 months constantly, and then I'm allowed to start massaging my scars with cream. And at my pre-op, Mr Fitton said that the most important part about it is the motion of massaging your incisions, area, chest, whatever. But it's the act of the massaging that is the most important thing, not necessarily what type of cream you use or brand basically, or oil, whatever. But it's the massaging that's the most important element. And that was really my whole appointment. It was really, really quick. It was so easy and not stressful whatsoever. Didn't have any pain. It was absolutely incredible. I couldn't have asked for it to go any better. I really can't believe how incredible my results are, and especially to be only 2 weeks post-op, for it to look as good as it does now. I'm just blown away, basically. I couldn't have asked for anything better. I mean, it's more than I could have ever have hoped for. Both the nurse and Mr Fitton, they explained everything so thoroughly. I was, again, not confused about anything, and they answered absolutely any questions I had. As this is my final appointment with Mr Fitton, he really constantly reassured me and my mum that regardless of how long down the line it is, or regardless of how small little teeny worry or concern I've got about my chest, that I can always contact him, which really made me feel a lot better, because I know that I get really worried about things and I'm like, oh my god, is this normal? Like, is that a concern? So knowing that he's happy for me to contact him with any teeny worry or concern I have at any point in my recovery just really made me feel a lot better, because he said that he would do anything he can, and I can either talk to him over the phone, I can see him over Zoom, or I can book an appointment to go down and see him depending on what the problem is and how I feel. So he really did reassure me that just because that's the last booked appointment doesn't mean that that's the last time I can talk to him. And this appointment, you could really see that Mr Fitton absolutely loves what he does, and that it's just so important to him when he sees patients are happy, and you can tell that's why he does it. He just wants to make people happy, and that is exactly what he does. He is fantastic at what he does, and I couldn't be happier. He's given me better results than I could have ever hoped for. I never thought I would be this happy, and I will continue to update everyone on how my recovery is going now. So yeah, everything's looking good. So I will leave a link below to my chest reveal actually being filmed, because Mr Fitton let me film it, which was very nice of him to do. So I will put that in my link below so you can see that if you want to see exactly what happened without me describing it like this. And I will also leave a link to my blog and my Instagram in case you want to ask anything. So I will see you later.